a good psychiatrist can feel like a cruel joke. When you are struggling with anxiety, ADHD, or a major depressive episode, your executive function is at an all-time low. Yet the medical system expects you to research, call, interview, and evaluate a specialized doctor while your brain is operating on emergency backup power. Because of this, many people end up booking the first doctor who has an open slot, only to realize months later that they are paying hundreds of dollars to someone who isn't actually helping them get better. As a psychiatrist, I see the aftermath of bad clinical matches every day. Today, we're counting down the top 10 things you need to look for when picking a psychiatrist. I'm going to give you the exact green flags that mean you found a keeper, and the dangerous red flags that mean you need to run out the door. Hi, I'm Dr. Shauna. Let's make sure you get the care you actually deserve. Let's start with the very first interaction, the initial evaluation. A major red flag is a psychiatrist who diagnoses you with a complex, lifelong condition within the first 15 minutes of meeting you. If you sit down, list 3 symptoms, and they immediately hand you a prescription for a controlled substance or a heavy antidepressant without asking about your medical history, your sleep, or your trauma background, you are in a psychiatric assembly line. A high-quality psychiatric intake should take anywhere from 45 to 90 minutes. Your brain chemistry does not exist in a vacuum. A green flag psychiatrist will spend the first session digging into your physical health, your family history, your past reactions to medication, and your lifestyle. They will look at you as a whole human being, not a walking list of diagnostic criteria. If the initial interview feels rushed, the entire treatment plan will be rushed too. The next issue is a massive issue in modern medicine, the follow-up. Once you are established with a doctor, you will need a routine follow-up appointments to adjust your dosages. In corporate medicine, these are called medication management or med checks. If your follow-up appointment consists entirely of the doctor asking, any side effects? No? Okay, here's your refill. See you in 3 months. That's a major red flag. Now, psychiatrists are medical doctors, not necessarily talk therapists. But a green flag doctor knows that a medication cannot properly be evaluated without context. They should be asking about your relationships, your work stress, your cognitive clarity, and your quality of life. If they don't know what's happening in your life, they cannot tell you if a medication is actually working or if you're simply white-knuckling your way through a bad week. Number 8 is assuming all psychiatrists are the same. Psychiatry is a massive field. A doctor who spent the last 20 years treating severe schizophrenia in an inpatient hospital setting is going to have a completely different clinical lens than a doctor who specializes in adult neurodivergence like ADHD and autism. The red flag here is a practitioner who claims to be an expert in everything, or a doctor who treats complex neurodivergence with a generic, outdated checklist. The green flag is a psychiatrist who openly states their subspecialty or interest area on their directory profile. If you have adult ADHD, you need a doctor who understands executive dysfunction, rejection-sensitive dysphoria, and the biological differences in stimulant processing. Don't be afraid to ask a prospective doctor, what percentage of your practice consists of patients with my specific condition? Number 7 comes down to the power dynamic in the room. Does your doctor treat you like a partner or like a subordinate? A massive red flag is a psychiatrist who gets defensive, annoyed, or dismissive when you bring your own research to the table or ask questions about a specific drug mechanism. If their attitude is, I went to medical school, so do what I say, it's time to leave. The green flag is a collaborative clinical relationship. Your psychiatrist may be the expert on pharmacology, but you are the absolute, undisputed world expert on your own body. A great doctor will present options. They'll say, based on your symptoms, we could try option A, which helps with sleep, but might cause a little bit of fatigue, or option B, which is more energizing, but then can cause a bit of anxiety early on, which sounds like a better match for your lifestyle. You should always have a vote in your own treatment. The next issue is something you usually don't think about until you're in a crisis, the administrative infrastructure. What happens when you have a pharmacy emergency? What happens if it's a Friday afternoon, your insurance company suddenly denies your prior authorization, and you are facing a weekend of sudden medication withdrawal? The red flag is a practice where it's impossible to reach a human being. Emails go unanswered for a week, or the portal messages are locked behind a maze of automated menus. The green flag is clear, transparent communication, guidelines established during your first visit. A good office will explicitly tell you, if you have a medication side effect, message us here and we will respond within 24 business hours. If you need a refill, give us 3 days notice. You need to know that there is a reliable safety net when things go wrong. The next issue involves reliance on a single tool. If your psychiatrist believes that every single psychological problem can be solved exclusively with a prescription pad, that's a red flag. Medication can be incredible, life-saving structural foundation. It can stabilize your neural baseline, give you emotional breathing room, and quiet the noise in your head. But a pill cannot teach you communication skills. It cannot heal childhood trauma, and it cannot restructure your daily routine to accommodate an executive functioning deficit. The green flag is a doctor who views medication as just one part of a comprehensive ecosystem. They should actively coordinate with your therapist, discuss dietary and sleep hygiene, and suggest lifestyle adaptations. If they aren't asking about your broader recovery ecosystem, they're just treating symptoms, not building long-term wellness. Number 3 is a subtle but incredibly damaging red flag: clinical gaslighting. This happens when you report a side effect or a bad reaction to a drug and the doctor dismisses it by saying, that medication doesn't cause that symptom, or it's just your anxiety making you think that's happening. While it's true that some symptoms can be driven by anxiety, a green flag psychiatrist will always validate your physical experience first. They will take your subjective reports seriously because they know that clinical trials only represent averages. Every individual body has unique genetic expressions, metabolic rates, and liver enzymes. If you feel like you have to defend or prove your physical suffering to your doctor, the relationship is broken. The next is the logistical reality that heavily impacts mental health: financial transparency. Psychiatry can be incredibly expensive, whether you're using insurance or paying out of pocket. A major red flag is a clinic that hides its fee structure, bills you months after the fact with surprise fees, or refuses to help you navigate the prior authorization process with your insurance company. The green flag is a practice that puts their fees, billing policies, and insurance network status completely out in the open before you ever sit down in a chair. They should be willing to provide you with super bills for insurance reimbursement and be conscious of medication costs when writing prescriptions, opting for generics or utilizing savings programs whenever possible. Your healthcare provider shouldn't be a source of financial trauma. And finally, the number one thing to look for when picking a psychiatrist is your own intuitive sense of psychological safety. Psychiatry is unique compared to other medical specialties. You aren't just showing up to have a bone set or a mole checked. You're sharing your deepest vulnerabilities, your darkest thoughts, your failures, and your internal struggles with a relative stranger. The absolute biggest red flag is feeling judged, dismissed, or subtle shame when you leave their office. If you find yourself holding back information, lying about whether you took your pills, or hiding your actual symptoms because you are afraid of how your doctor will react, you cannot get well under their care. The ultimate green flag is a profound sense of relief when you sit on that couch or log into that telehealth call. You should feel seen, respected, and completely safe to say, I messed up. I didn't take my medicine this week, and everything fell apart. Knowing that their only response will be curiosity and compassion. Finding the right psychiatrist takes patience, and it might take a few tries to get it right. But remember, you are the consumer here. You are hiring a specialist to help you manage your brain health. Don't settle for an assembly line. Don't settle for clinical gaslighting, and don't settle for a dictator. Hold out for a partner. I'm Dr. Shauna, and I'll see you in the next one.